Hello and welcome to the Royal College of Nursing e-learning resource on frailty. I'm just going to give you a little introduction to frailty before you start your e-learning. So we'll start off by thinking about what is frailty. Well, frailty can be considered a long-term condition as any other long-term condition, so alongside things like COPD, heart failure, arthritis, diabetes. But frailty is characterised by a loss of physical, emotional and cognitive resilience as a result of the accumulation of multiple health deficits. As we age, our body systems deteriorate and we will start to accumulate these health deficits. And as this gradually affect our functioning, then frailty will start to manifest itself. So frailty is progressive. It typically erodes the functional, the cognitive and the emotional reserves of an older person, and it increases vulnerability to a sudden loss of independence and adverse outcomes following a comparatively minor stressor event. So that could be maybe an acute infection, an injury or a change in social circumstances. While severe frailty can be quite easy to recognise, it's more difficult perhaps to diagnose lesser degrees of frailty, and it can be difficult to differentiate that from normal ageing. And as nurses, we have a key role to play in making this diagnosis and identifying frailty at an early stage. So why is frailty an important nursing issue? Well, it's an important nursing issue because unless you're a children's nurse, you are going to nurse older people. And frailty is a common health state in older people. People living with frailty are the highest users of health and social care resource and the highest users of unplanned admissions, but also attendance at emergency departments. We know that frailty is common. Once you reach the age of 80, between 1.25% of people will be frail. And we know those people, as we've said, are more at risk to adverse outcomes such as admissions to hospital, care home admissions, becoming more disabled and more socially isolated, and frailty is highly correlated with death. However, we do know that there is evidence in this group that some adverse outcomes can be avoided through proactive case finding, timely comprehensive assessment, care planning and targeted proactive services, particularly out of hospital in a community setting. Like any other long-term condition, frailty can be effectively managed within primary and community care. It takes 5 to 10 years to develop, and there's often a slow trajectory of functional deterioration. And often at the moment, older people with frailty will present in crisis. And we manage that crisis, but we don't always recognise and understand the underlying vulnerabilities. We know that 10 days in a hospital bed equates to 10 years of muscle ageing in an older person with frailty, so care at home is vital. We know that early identification of frailty and clear consideration of ways to optimise care and support for adults with multimorbidity. There are interventions that can be used to manage its progression effectively at key stages. And these focus on reducing the likelihood or planning for the impact of crisis and ensuring optimal recovery and really effective rehabilitation if crisis does occur. So how can nurses identify frailty if we're not specialists in the field? Well, identifying frailty isn't difficult, that's the good news. It's about being alert to the signs and symptoms when we interact with older people, whenever we encounter them. Early frailty may manifest as functional changes, which older people themselves sometimes just dismiss as natural ageing. They might feel they're slowing down, they might feel they're not as strong as they were, or perhaps they're not as mobile as they were. These are real clues, and nurses have key roles in recognising those symptoms of early frailty and supporting people to take action at that point. As frailty progresses, then we know that people will start to present with what we call frailty syndromes. Those are things like falls, sudden loss of mobility, delirium, and experiencing adverse effects of multiple polypharmacy. If you encounter a patient with any of these issues, they probably have underlying frailty and so should be assessed. There are a variety of frailty identification tools, and many of these we will cover in the frailty e-learning to help you in your practice. So how can nurses assess frail patients and support them? Well, we know the gold standard intervention is known as a comprehensive geriatric assessment, or CGA. This is a multidimensional assessment of the older person's needs carried out in partnership with them and their carers, something that as nurses we are really skilled at undertaking and leading. Frail older people receiving CGA in an inpatient setting are more likely to return home, less likely to experience cognitive or functional decline, and have lower in-hospital mortality. And then CGA in a community setting, we know now can increase the likelihood of people living at home, principally through the reduced need for care home admission and also reducing some of those frailty syndromes, particularly falls. So once we know someone's frail, what are the interventions available for people with frailty? Well, I've already mentioned the need for CGA as the starting point and gold standard approach to care. But other interventions that we know to be effective include exercise. Now, exercise has physiological effects on the brain, the endocrine system, the immune system, and it strengthens skeletal muscle and prevents what we call sarcopenia, which is a really key component of frailty and leads to that loss of mobility and muscle strength. Other effective interventions that we know are available are optimising nutrition, and recent NICE guidance on the prevention of frailty and dementia advocate a healthy lifestyle. So this includes approaches such as smoking cessation, maintaining a healthy weight, exercise, and remaining socially engaged. All of these are really important factors for preventing frailty. I believe as nurses we have a key role in supporting patients to make these lifestyle changes and to understand their roles in preventing frailty deterioration and preventing adverse outcomes for older people. So thank you for viewing this brief introduction to our e-learning module. I hope you enjoy your learning experience and find it useful in improving your practice and your care of older people living with frailty.